decrease in the plasma triglyceride, LDL, VLDL, and increase the HDL. Endocannabinoid system, it is also involved in regulation of the body weight or regulation of the feeding behavior. Since one of the medicaments that used in treatment of appetite suppression is the rimonabant, which is the cannabinoid receptor antagonist, which was originally developed for smoking cessation. The drug was introduced as an appetite suppressant following some encouraging clinical trials, but eventually withdrawn in 2008 because of the adverse effects. And nowadays there is a similar fate overtook. Another promising cannabinoid receptor antagonist include the taranabant. The orlistat, which is widely uncommon drug, actually it is acted by a different mechanism, not centrally. It inhibits the two enzymes, whether gastric or pancreatic lipases enzyme, thus resulting in the inhibition of the breakdown of fatty or neutral fat to form fatty acids and glycerol. It therefore decreases the absorption of 30% of dietary fat. In addition, orlistat, it is reported to be effective in patients suffering from type 2 diabetes and other complications of obesity. It reduces leptin levels and the blood pressure, protects against weight loss-induced changes in the biliary secretion. New approaches to the obesity therapy. Rare cases of leptin deficiency in patients have been successfully treated by long-term with the hormone, but this is unusual intervention. Actually, in obesity, there is an increase in the level of leptin, and there is increase in the resistance to the leptin. Maybe defect in the kinetic, maybe defect in the permeability of leptin to the central nervous system, or maybe defect in the post signal of binding of leptin to the receptor. So actually the use of exogenous leptin give no therapeutic value. Many other approaches are being piloted, some of them to exploit the action or production of neuroendocrine satiety signals, such as CCK, cholecystokinin. It is one of the intestinal hormones. When bind with certain receptors in the CNS, result in the appetite suppression. Glucagon-like peptides such as liraglutide, my colleagues mentioned that. It is one of the liraglutide, one of the incretin mimetic agents used in the treatment of diabetes, type 2 diabetes. But fortunately, it enhances satiety. That's why using in treatment of obesity. Other peptide YY is under investigation for human use, which is one of the intestinal hormone that can be used in the treatment in the future in treatment of obesity. The tractability of melanocortin-4 receptors. This receptor is very important for anaerogenic action, since any agonist or any ligands that act on such receptors associated with suppression of appetite, in which in obesity there is defect in the signaling of melanocortin receptors. Sympathetic nervous system, it is another approach in the treatment, new approach in the treatment of obesity. Actually, V3 adrenoreceptors might be useful therapeutics. This field has been extensively researched, but disappointingly has so far failed to produce acceptable drug. And V3 receptors, actually, they are present in the adipose tissue, whether in fat, in white fat cells, or in brown fat cells. When activated, associated with a decrease in the thermogenesis in the brown cells, and increase the lipolysis in fat cells. That's why beta cells consider, or activating of beta cells considered as a promising values or promising effect when used certain ligands act on these receptors. Most drugs therapies are much more effective when used in conjunction with lifestyle and other behavioral modification. Now we have the conclusions. Diet, exercise, and long-term lifestyle changes remain the cornerstone of the treatment. And surgery should only be considered for morbid obesity with significant health-related health problem. Successful treatment of obesity therefore requires an integrated and multidisciplinary approach with input from a variety of health professionals. The last point, strategies and public health campaigns will be necessary to produce an environment that supports health eatings and physical activity throughout the community. Thank you so much for your listening.